When you picked your last insurance plan, did you pick on premium alone or did you compare to the total yearly cost? Here's the mistake most people make. They pick a health insurance plan based only on the monthly premium. It looks cheaper at first until something happens. Then the bills pile up and that bargain plan starts to feel expensive fast. In this module, we'll walk through how to choose the right plan for you and your family based on real numbers, not guesswork, so you can avoid the traps that cost people thousands of dollars. The agenda for this module: the three main types of plan: high deductible versus low deductible, understanding plan levels: bronze, silver, gold, platinum, network types: HMO, PPO, EPO, the family factor, the network trap, pro tips for choosing wisely, plan comparison, walkthrough, common mistakes, and closing and next step. Which system are you shopping in this year? Employer, marketplace, or government? How does that starting point limit or expand your choices? The three main types of plan. When you shop for insurance, you usually see these three categories. So, number one, employer sponsored plan. These come through your job. Your employer typically pays part of the premium, which makes them cheaper than buying on your own. The trade off is fewer choices, often one or two options, like a HMO or a PPO. Now, here's an example. Jordan's company pays 70% of his premium. He chooses between a HMO and a PPO, limited choice, but greater price. 2. Marketplace HCA plans. If you don't get coverage at work, you can buy it through healthcare.gov or your state's exchange. These are common for freelancers, small business owners. Depending on your income and household size, you may qualify for premium tax credit that lowers monthly costs. Here's an example. Linda, a self-employed photographer, qualified for a $300 tax credit. Her $550 silver plan dropped to $250 a month. And lastly, government plans, such as Medicare, generally age 65 and older, or certain disabilities, and Medicaid, income and eligibility based state run coverage large portions of the population. Most Americans are covered by one of these three systems: employer, marketplace, or government. Start by identifying which system you're in. That alone narrows your choices and keeps you from comparing the wrong plans. In a typical year, do you use care a little or a lot? And how steady is that pattern? Would you rather budget predictable premiums or risk variable bills when care happens? High deductible versus low deductible. This is where most people get tripped up. High deductible plus low premium. Cheaper each month, but more out of pocket when you use care. Best for people who rarely see the doctor and can handle variable costs. Low deductible and high premium. Higher monthly costs, fewer surprises when you need care. Best for families or anyone with regular visits, prescriptions, or known procedures. Now, here's an example. Alex, 27, sees a doctor once a year. He chooses a high deductible plan and saves $150 a month. Tina has asthma and 2 kids. She pays more monthly and saves hundreds in copays and medication. Now, here's a pro tip. If you choose a health savings account eligible for a high deductible health plan, You can contribute pre-tax dollars to a health savings account. Health savings accounts funds roll over, can be invested, and after 65 you can use them for anything without penalty. Non-medical uses are taxed like income. Think about your usual year. Do you see the doctor often or hardly at all? Your answer points to which deductible style fits best. Do you want the lowest monthly price or lower cost when you actually use care? Which metal level matches your expected uses this year? Understanding plan levels: bronze, silver, gold, and platinum. Marketplace plans use metal levels to show how costs tend to be split. Bronze, lowest premium, highest out of pocket when you use care. Silver, middle ground, moderate premium and cost share. Gold, higher premium, lower out of pocket when you use care. Platinum, highest premium, lowest out of pocket for heavy users of care. Now, here's an example. Carlos picked a silver plan because his wife has regular checkups. It costs a bit more monthly, but they save on labs and specialist visit. Now, did you know if you qualified based on your income, cost sharing reductions are only available on silver plans? They lower deductibles and copay for eligible households. Think of medical levels as risk sharing. Bronze, you carry more of the cost when you use care. Gold and platinum, the plans carry more. Do your must keep doctors and hospital fit in your network you're considering? How much is referral flexibility worth to you in dollars? The type of networks: HMO, PPO, and EPO. Networks control which doctors you can see and how much you pay. So HMO, Health Maintenance Organization, uses lowest premiums. You must use in-network providers and often need a referral for specialists. PPO, Preferred Provider Organizations, higher premiums, but you see specialists without referrals, and there's some out-of-network coverage. EPO, Exclusive Provider Organization, a middle ground, lower cost than a PPO, but no out of network coverage except emergencies. Now, here's an example. Dana picked a cheap HMO plan, but didn't realize her dermatologist was out of network. She paid $180 per visit. A PPO would have covered most of that. Decide how important flexibility is for you. If you want to choose your own doctors freely, a PPO or EPO may be worth the higher premium. List your household's likely visits, meds, and specialists. What does that pattern suggest about your deductible and copay? Should spouses stay on separate employer plans or combine? Which math wins? Now, the family factor. Insurance choices changes once you add family members. Kids, check urgent care and ER copays. Children get sick at inconvenient times. Chronic condition. Focus on the deductible and coinsurance. You'll use them more. Two working adults, compare each employer's offer. Sometimes keeping separate plans is cheaper than joining one. Example: the Wins realized adding both kids to dad's plan was cheaper than splitting them because his employer played a larger share of dependents. Now, did you know some employers charge a spousal surcharge if your spouse could get their own employer coverage but joins your plan instead? Ask HR before you decide. Family plans aren't one size fit all. List each person's doctors, meds, and likely visits for the year. Then pick the plan that matches. Are your key providers and hospitals in network on the plan you're about to choose? Have you double checked the directory and confirmed with the office? The network trap. One of the costly mistakes is choosing a plan that doesn't include your preferred providers or hospital. In network equal discounted negotiated rates. Out of network, much higher costs or no coverage on many plans outside of emergencies. Before enrolling, list your clinic and hospitals. Next, check the plan's online directory to confirm if they're in network. 3. Call the office to confirm directories can be out of date. Now, here's an example. Liana's OBYGN was in network, but the hospital wasn't. Her delivery cost $3,000 more. One pre enrollment call would have prevented it. A 5-minute search before you enroll can prevent a 5-figure bill later. What are your two numbers for each plan? Total expected cost and worst case cost. Which plan minimizes the risk that worries you the most? Pro tips for choosing wisely. When comparing plans, don't just look at the monthly price. Use these rules. 1. Calculate two numbers. Expected year cost, 12 months of premium plus your best estimated of visits, meds, and typical cost share. Worst case cost, 12 months of premiums plus the plan's out-of-pocket maximum. 2. Check your out-of-pocket maximum for financial safety net. Lower is safer if you worry about big bills. 3. Use comparison tools, employer portals, or healthcare.gov to see side-by-side estimates. 4. If you're healthy and rarely use care, consider the health saving eligible high deductible health plan and bank the difference in a health savings account. 5. If you have regular medical needs, a lower deductible plan often reduces stress and surprise billing. Now, did you know healthcare.gov has tools that can estimate annual spending based on how often you see the doctor or fill prescriptions? Side-by-side math reveals the real cost. The cheapest premium isn't always the cheapest plan. Ready to plug in your own numbers like Mary did? Which line item, premiums, meds, or urgent care will swing your decision? So plan comparison walkthrough. Let's walk it in real life. Step 1. Mary has 3 employer plans: bronze, silver, and gold. 2. She lists the needs: 2 prescriptions and a child who uses urgent care twice a year. 3. Compare bronze $150 premium, $6,000 deductible; silver $230 premium, $3,000 deductible; gold $320 premium, $1,000 deductible. When she totals her annual premiums plus expected visits and meds and worst case scenarios, premiums and out of pocket, silver is the cheapest overall plan for her family's pattern. The lowest premium isn't always the lowest total cost. Do the math. Which trap are you most at risk for? Ignoring networks, skipping formulary, or rushing last minute? What's your checklist to avoid it? Now, here are the common mistakes, big traps to avoid during open enrollment. Focusing only on the monthly premium, forgetting to check network, skipping the drug formulary, are your meds covered and at which tier, rushing your decision on the last day. Now, here's an example. Erica rushed and missed that her specialist was out of network. Now she is locked in and pays $180 per visit out of pocket. A few hours of research can save you months of frustration. What's the first action you'll take? List providers to check networks, total your expected costs, or compare plans out-of-pocket maximums side by side. If you had to decide today, which plan type would you choose and why? Now you know how to choose smart. Understand your plan type, balance premiums and deductible, match benefits to your family's need, confirm your network and hospitals, compare total yearly costs, not just monthly numbers. With these steps, you can walk into enrollment or the marketplace with confidence instead of confusion. Next, we'll cover hidden ways to save money, billing codes, appeals, and in network tricks that can put real dollars back in your pocket. I'll see you in the next module.